again, everybody. This is Dr. Mark Trolice at Fertility CARE, the IVF Center in Orlando, Florida. Hope you had a great week, and we were going to talk about the treatment for recurrent miscarriage, but today there was a breaking news announcement on the first live birth from uterine transplant. So I thought I would talk with you all about that a little bit since it's so timely, and then next week we're going to resume the recurrent miscarriage treatment, the part 2 section, okay? So let's get into the story today. It's all over the news, and it involves the first successful uterine transplant resulting in a live birth. So a little bit of background. Since 2014, there have been 8 other reports of live births from uterine transplant. What is this all about? Typically, women who are born without a uterus, a congenital abnormality called Mullerian agenesis, okay, or long-term is called Rokitansky-Kuster-Hauser-Meyer-Kuster-Hauser syndrome. So they're born without a uterus. To do a uterine transplant is very involved, okay? The living donor that's going to give the uterus to the recipient doesn't just have a hysterectomy, it's a very extensive, that takes hours because they're going to need to get the nerves and the blood vessels to be able to transplant that into the recipient. So that surgery is long. The recipient then receives an extensive surgery to implant a uterus into and cervix into her body. What happens then? Well, she needs to go on immunosuppressant medication to prevent the rejection of this foreign organ in her body, okay? And that needs to continue. And some of these researchers are waiting about a year before even having the woman attempt pregnancy, okay? And certainly their periods have to resume to ensure that the uterus is functioning. So, how do they get pregnant? Well, since the reproductive organs are not in place as they would be anatomically when they were born, you need in vitro fertilization to ensure that the egg and the sperm meet, because after the transplantation, the fallopian tube and the ovary don't have that same relationship for the fallopian tube to pick up the egg. So you do in vitro fertilization. That's costly, okay? And certainly no guarantee. But if God willing, she then gets pregnant, now she stays on the immunosuppressant medications, which certainly have risks. Then she goes to term and cannot have a vaginal birth because they don't want to put too much pressure on the uterus itself. So she has a cesarean section, surgery number 2 for this. Once she delivers, she has to stay on the immunosuppressant medication. And if she's not going to have another child, then it's another major surgery to remove the uterus. Otherwise, it's lifelong immunosuppressant medication. So that technology is here and being done now. The first live birth, obviously there'll be more. There are definite risks in doing this. And what it's doing is replacing surrogacy for some of these women. So I will keep you abreast of any new developments in this area. It's certainly a dramatic breakthrough, only at a few specialty centers. So I hope this was informative for you all. Have a fantastic week. I hope you're having a joyous holiday season, and we'll see you next Monday. Take care.